My room. Urinary tract infections or UTIs are a common type of infection that can be treated easily with antibiotics. And I'm sure you've learned about this. We did discuss it previously with Dr. Salim Choonara. Sometimes, though, the bacteria that caused the UTI can infect your bloodstream. Now, to tell us more, we have our urologist, Dr. Salim Choonara. Assalamu alaikum, Dr. Salim, and shukran for joining me once again.
Walaikum salam, Maryam. Thank you so much, and salam to your viewers and listeners as well.
Alhamdulillah. Now, doctor, before you give us some more insight on a or rather urosepsis, what is a sepsis?
Okay, so sepsis, it's a term, it's a medical term that we refer to that denotes a stage in the infective process. Okay, so so if you think about infection in a continuum, let's say from a mild infection that you can just treat for yourself at home and you're fine with it, to something that starts progressing. Okay, and wherever this infection source can be, in this case, obviously we're focusing on the urinary tract, but that infection could be in any part of the body. It's when an infection that's localized to a particular organ then eventually gets into the bloodstream. Okay, that concept, that phenomenon is referred to as sepsis. And sometimes we also talk about septic shock, urosepsis. So all those terms sort of intertwine at some point in that continuum. So in other words, just to summarize it, basically there's a very severe infection that may not have responded to conventional treatment for whatever reason, and we'll get to some of those points in the discussion. But the infection then eventually spreads into the bloodstream, and that's an important aspect.
So when the infection spreads into the bloodstream, then it is regarded as a urosepsis.
Yeah. Now, sorry. The issue about urosepsis, now in this case, obviously, because uro meaning urology, we're talking about the urological system, and we put in sepsis to that. So in other words, here we're specifically focusing now on infections that would involve the urinary tract, such as what would that be? Kidney, the pipes of the kidney to the bladder, ureter, could be the bladder as well, could be infection in the prostate, urethral infection. In other words, anywhere along the urinary tract, infection that has started there, and from there progressed into the bloodstream, is now would refer to as urosepsis. Now, obviously, it's like, why don't you think of it like a syndrome? That's why we talk about septic shock syndrome. Why are we referring to that? So there's multiple things that come with that. Okay, it's not just that the bacteria is now gone into the bloodstream. More than anything else, it's the reaction of the body to finding now bacteria or an infection focus in the bloodstream. So your body has a massive reaction to that, and people vary in how they react to that. I mean, to the extreme of that, people with severe urosepsis, sepsis, septic shock, require ICU, require ventilation, they go into renal failure. There's a whole lot of other organ systems that now get affected because they are responding to an infective focus in the blood. So that would be sepsis or septic shock. Urosepsis, now we're just trying to say that the sepsis here is related to a urological infection. We're just homing in on the urological system.
All right. Now, doctor, what are the signs and symptoms of urosepsis?
First of all, urosepsis, the reason why it's sometimes discussed as a separate group, we're not just talking about sepsis per se, but we're talking about urosepsis, or it's almost like a separate entity, is because it is relatively common, and also it is associated with significant mortality, So the mortality is about close to 40, maybe 40 to 50% of patients that suffer urosepsis may actually die, So it can lead to death, okay? It is very, very severe. It is, and some of the signs that we pick out from that will be things like, obviously, patients become very, very ill. So they may have an infection which is not settling down. They have persistent, focus of infection in the urine. Maybe we culture the urine, we find the bacteria in the urine. They can develop things like fever because the body is now reacting to this infection in the bloodstream. They may have effects on their blood pressure. They become hypotensive. Blood pressure drops, pulse may start racing away, chills, rigors. Start feeling very, very ill looking, They can even, their consciousness level can also start waning, start dropping as well. And, often when we talk about urosepsis, because I mentioned to you, there are some risk factors that would lead to this kind of thing being more evident or being more pronounced in certain patients, is because it's more, we see it more in those patients that are diabetic, patients that are elderly, guys that are maybe bedridden, have had catheters in for a long time, and so they're already compromised to some extent, and we tend to see that in that group of patients. So already the patients are not a little bit sick already, and then they got something that predisposes them to getting infections routinely or commonly, and untreated infection may then eventually spread into the bloodstream, right? So I think the key factors there are things like a fever, drop in the blood pressure, level of consciousness that wanes a bit. And just a point about that, Maryam. You see, like I said, in our case, in our situation, when we see these patients, remember, it's very subtle signs because some of them are already bedridden. They may have catheters. They may be in an old age home, for example. They may be in some care home. They've got long-term catheters, for example. So their consciousness level is already a little bit down. They may not be responsive. They don't really walk around much. They're more bedridden. So you don't always get these typical signs that may come out in somebody who's very coherent, who can talk to you, who can explain how they're feeling. One is to look out, especially in that group of patients. Those are the ones that can really deteriorate very, very fast because you're watching them, they look fine, they look like they look every other day, and then suddenly you find their blood pressure starts dropping, and then they're getting a lot of other signs to suggest that infection is not in the bloodstream. So one is to identify more than just picking out the patient with urosepsis. You also want to be alerted to those risk factors that will make a patient more likely to develop urosepsis. So you're sort of on the lookout for it, if you get what I'm saying.
All right. Now, you were mentioning about people who are healthy and wouldn't necessarily know that they have urosepsis. So how would you diagnose it if a person doesn't really know that they have this?
Okay. Yeah, so I think it would be, just to clarify that point, I mean, I don't think it would be a common situation that somebody who's young and healthy and otherwise fit would have a severe infection and not know about it, For example, let's take an example. Let's say maybe a young diabetic patient, otherwise healthy and well, develops an infection in the urinary system, progresses to a kidney infection, but and then suddenly they become much more ill, They start getting high fevers, they're not feeling well, they're lethargic. They see the GP, they find the blood pressures are all down. So we know, okay, this patient, we need to watch this patient. We need to get this patient to the hospital. We need to check their blood, do blood cultures, check is there bacteria in the urine. So they may be otherwise awake and they're coherent and they're talking. That's one group of patients, They may be able to relay their symptoms, and they may also seek help, and they may go out and they can walk, they can get to a care facility, etc. You know what I mean? So those kind of patients, you'll know that they're deteriorating over time. Whether it be a few days, whether it be a week or two, you'll be able to pick out those features, And I think the mainstay there would be somebody's not getting better, That's the simple summary of it all. You get an infection, but you're not getting well. You're feeling sicker, you're not feeling well, your fevers are up, you're on antibiotics, but you don't feel well, you don't recover nicely. Those situations can progress, right? Now, having said that, let's also not lose sight of the point here. There's obviously a big overlap when we're talking about urinary infections, right? You mentioned it in your introduction. Let's say, for example, somebody has a bladder infection. Okay, simple cystitis. Most females generally suffer from bladder infections commonly, not uncommon. But in some patients, for whatever reason, maybe they're immunocompromised, they're on medication, they're on steroids, they're diabetic, they've got some abnormalities with the urinary tract. So a simple bladder infection, which would otherwise would have just gone away with simple antibiotics, would probably then progress maybe first to a kidney infection, and then that doesn't get better, and then eventually they will progress now to something where the infection enters into the bloodstream. So there's some relative level of progression, from where an infection in the urinary tract, now because we're talking about urosepsis, would then progressively get worse, and eventually this patient is just getting sicker or not getting better over a couple of days. They may be at risk for developing urosepsis. Do you know what I mean? So it's not necessarily something that's going to happen. You get a mild infection and you're going to get urosepsis. No, I mean, I don't think that's the point here. You know what I mean? There is a progression. We can pick it out in the majority of patients. I was just highlighting certain individuals that can't otherwise talk for themselves. They're otherwise bedridden. They have Alzheimer's. They're sick. They're in old age homes. They've got catheters to drain their bladders. Those people will just lie there and they can't say much. They can't do much, So that kind of group, one is to be extra vigilant from a healthcare perspective, from the people looking after them, whether they be at home, whether they be in a health facility. One needs to be a bit more alerted about those patients. And often we notice in those kind of patients, their consciousness level starts to drop, or their eating habits suddenly change. But it's subtle signs. It's not like somebody who can report a lot of changes to their bodily functions, like fever, pain, they can say, I'm not feeling well. Somebody who's bedridden, who's otherwise confused, not saying much, they may not respond as you expect the average person to respond, So we've got those groups of patients that we need to be alerted by.
All right, Dr. Choonara, please stay with us. We are going to take a quick break and we will continue thereafter, inshallah.
At a shocking 11%. 1 July is day zero for the Kucha Dam, resulting in dry taps for hundreds of families in the surrounding areas of Port Elizabeth. Help us strategize. Support our water drive in the Eastern Cape region of South Africa. Donate your lilla towards the erecting of JoJo tanks in impoverished areas and for the vehicles to deliver water in areas of need. Donate to the Al Fida Foundation. Visit our website at www.alfida.co.za or contact us at 041 484 1288.
Looking to get your kick? Kiki's have now reopened on 235 Matthews Maiwa Road in Durban. Head on over for the Taste with Kick. We offer something scrumptious for everyone in the family. Wraps, chicken tikka, burgers, tender grills, mocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the taste with kick.
Osman's Taj Mahal Spice and Rice. For over 80 years, Osman's Taj Mahal have been perfecting the art of the perfect blend of spices, pure, aromatic, and well-seasoned. Spices to tantalize your taste buds. From creative cuisines to gastronomical gourmet goodies, from exotic odors to traditional dishes, Osman's Taj Mahal have remained synonymous with quality spices and condiments. Taj Mahal rice, beans, and lentils. Try our range of chili bite mixes, rose and ilachi syrup, our quick and easy biryani pack, and our traditional range of spice blends. Osman's Taj Mahal. There is no substitute for quality.
Sustain, sacrifice, share. This Eid al-Adha, donate your Qurbani through Africa Muslims Agency. We ensure that your Udhiyah Qurbani not only feeds the poor but creates sustainable incomes for local farmers, brings the practice of sacrifice to the villages and shares the spirit of Eid. Sponsor in South Africa for 2,400 Rand. Africa 1,500 Rand. Palestine 6,150 Rand. Syria 4,000 Rand. Donate online at africamuslimsagency.co.za or call 011-834-8685. Africa Muslims Agency, inspiring the spirit of giving.
Listen to something fresh. Listen to Salam Media.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media. It is 11:19 and we are talking about urosepsis, which is a type of sepsis that is caused by an infection in the urinary tract, and it's sometimes the bacteria that cause the UTI can infect your bloodstream, and that's when it becomes a problem. Dr. Salim Choonara is our guest for today and giving us some information and insight on sepsis as well as urosepsis and who are at risk, as we spoke about before the break. And if you have any questions for Dr. Choonara, you can leave them in the comments section, or you can send them to our WhatsApp line on 061 766 0355. Dr. Salim Choonara, shukran for staying on the line. Now, we were talking about people who are bedridden and can't really explain how they're feeling when it comes to getting a infection or anything. Now, if they have a urosepsis, how long does it last in their system? Is there a time frame before it becomes life-threatening?
Yeah, that's a good question. I think that's the point, that we don't necessarily want to be giving urosepsis a time frame. So if somebody has a urinary infection and they're not settling down or they're not responding to treatment, once it gets to urosepsis, it's already at a critical stage. Urosepsis left untreated, in a high percentage of patients will die. In majority of patients will actually they will deteriorate, and that can lead to significant organ failure, kidney starts failing, heart starts getting strained, liver starts being affected, all organ systems start being affected, and patients can actually die from that. So I think we must be able to recognize the urosepsis, not allow urosepsis to progress. If I understand your question correctly. So the idea is that, especially in the older patients we're bringing up now, and it's an important topic to sort of just put aside, is that, the typical case would be somebody that has, for example, they are bedridden, so they can't get to the toilet, or they may have some bladder issues, or they could have had a blockage of the urinary flow, and they've got an indwelling catheter. Now, one has to be alerted to things like what? You may find that the urine starts appearing cloudy, may start appearing murky. There may be some pus that may be developing as the wound gets infected where the catheter goes inside or at the tip of the penis, for example, in a male patient. Patient is just not feeling well. They may have low-grade fevers. They may not be eating like how they normally would eat, or their typical responsiveness is now changed, So it's a subtle change, because remember, somebody in a care home, they don't always have the luxury of doing an immediate blood test. They may be able to check temperature, they could check their blood pressure, they could do a few basic things, But so those kind of patients, once we get alerted that this patient is not looking well, in the ideal situation, they need to be moved to a healthcare facility, maybe taken to a hospital. They need a whole lot of blood tests, urine tests. They may require stronger antibiotics. And more importantly, if, for example, we think the catheter is now the source of the infection, we take the catheter out, put a clean catheter, remove the focus of the infection, clear that out as the driving force behind the infection. Do you know what I'm saying? So one has to be able to recognize all these potential pitfalls, be alerted by them, and then react appropriately.
Now, how is it treated?
Okay, so when we talk about urosepsis, that's the focus of our discussion. That means we've already diagnosed that this patient's infection has entered the bloodstream. So often these patients are in a high care, even ICU type of facility. They vary, it depends on what their clinical status is like. They require medication to treat their fever. They require medication to bring the fever down. They require intravenous antibiotics, and often it's not just a single course of antibiotics, it's multiple antibiotics that are used to try to eradicate the infection. We may find that their kidneys are also failing, or their kidneys require support. Some of these patients, depending on how their clinical status look, how they've deteriorated, what kind of situation they're in, they may require to be on dialysis temporarily to support the kidney, right? They may also require support for their heart as well. These patients also can develop respiratory or lung issues. They may have difficulty breathing, etc. They become confused. They may lose their level of consciousness may go down. So they may also require to be on a ventilator, So again, it depends on what the patient is suffering from, what they are assessed, which organ systems are now being affected by the whole urosepsis. Then appropriately we would manage those organ systems as they go along. But the mainstay of treatment here is the identifying the focus of infection. For example, let's say somebody had a kidney infection. Kidney infection wasn't getting better. Now they develop, for example, an abscess in the kidney, for example. Now, since we've identified that could be the focus, we may have to consider draining that abscess out as a means of removing the initial focus, but at the same time supporting them with antibiotics, supporting their kidney, supporting their lungs, supporting their heart, whatever organ system requires support. Right? Now remember, it will differ for different patients, right? I'm just giving you an overview. But the mainstay of treatment, like I said, is the antibiotic treatment. And if we've identified a focus of infection, then that needs to be managed. There could be a stone in the kidney, in the urinary system. There could be a blockage. Maybe the catheter is blocked, or they are unable to empty their bladders. We must make sure that the system is unblocked. So you'll correct all the correctable things and manage them appropriately with antibiotics and support the various organ systems depending which ones are being affected by the urosepsis.
Oh no, does the sepsis ever leave your body, or is it there forever? Just gets treated with the antibiotics, but it stays dormant and then comes back again?
Yeah, no. So no, the answer is that no, it does get eradicated from your body, right? We do have some situations where people, because of their chronic situation, because they always require a catheter. So they may always have recurrent types of infections, or they may have bacteria that colonize their urological system, for example. It's different from urosepsis. Urosepsis, that particular entity, can be eradicated. The patient that recover from that, we get rid of the infection. They respond to the antibiotics, they respond to the supportive care, they respond to us removing whatever infection focus they could have been in the urological system, and they get better. And that infection leaves them. They recover, they get back to their normal lives. You see what I'm saying? So no. So in the majority of cases, yes, that gets eradicated, that gets treated. But since we were bringing up the topic about those patients in old age homes or care homes, etc. Remember, if they always require a catheter to empty their bladder, even after they've been treated for their urosepsis, they're still going to require a catheter to empty their bladders. You see what I'm saying? So the risk may still be there. At some point in the future, they could develop another infection. And it again could present with urosepsis again, right? But that will be now a new infection. Unlikely that it will be the same type of infection or exactly the same infection. It's just that because they're at risk, they have these catheters in, or they have some abnormality with the urinary tract. And even after they've recovered from a particular infection, does not mean they can never get another infection again.
All right, Doctor, shukran so much for your time there and for explaining to us a little bit more about urosepsis. I think some of us can rest assured that we might not get urosepsis, but we still need to take precautionary measures. Shukran, have a wonderful day.
Jazakallah khair. Thank you so much for having me.
All right, so that was Dr. Salim Choonara, a urologist, taking us through urosepsis. That's a type of sepsis that is caused by an infection in the urinary tract. If you know someone who is probably has diabetes and struggles to go to the toilet or is bedridden, etc., like the doctor said, those people who are in homes that are needing care and need somebody to look after them because obviously they cannot do it themselves. They might be, they are at risk rather of developing urosepsis, which can be life-threatening. So do go and check your families who are in these homes. I watched a show the other day where they were exposing some of these homes and how they're not really safe for families to be there. So I'm not trying to scare you here, but all I'm trying to say is that at least go visit regularly just to make sure that everything is okay and they are okay and their infections and their diseases or whatever they developed is cured and they are much healthier and can continue living their lives. For any further comments, questions, queries, or suggestions, please leave them in at the comment section or send them to WhatsApp on 061 766 0355. You are listening to the Mid Morning Talk on Salam Media with me, Maryam Mkwanda.